Gentlemen, take note. Have you noticed that you get out of bed to use the restroom 3, 4, or even 5 times every night? Have you noticed that the way your urine flows has changed? You feel as though your bladder never completely empties, or it's weak. This video is critically necessary for you if any of this sounds similar. This is a startling fact. Many men over 50 make one big mistake each time they urinate. The most concerning aspect is that a lot of people do it without even realizing they are endangering their own health. I'm here to tell you that it's not normal. They believe it's just a part of growing older. I'm going to reveal a practice that you may not even be aware of that could be harming your bladder and prostate. First of all, I guarantee that if you watch this video through to the finish, you will not only learn the proper technique you can begin using immediately, but you will also uncover this common error that many men make on a daily basis when urinating. But before we start, I have a question for you. What time is it currently, and where are you viewing this video from? Kindly leave a remark. Every message I read makes me feel closer to you. Additionally, please activate the bell symbol and click the subscribe button if you found this useful. In this manner, you won't overlook any more health advice created just for senior citizens like you. You can truly benefit from the information I'm going to impart. It can guarantee that your bladder empties completely, greatly increase urine flow, lessen prostate inflammation, and, most importantly, allow you to sleep through the night without having to use the restroom frequently. Most people are unaware of how much this problem affects men's quality of life. Stay with me as I reveal the reality that could permanently alter your bathroom habit. I'm Dr. Jane, a urological specialist who has been treating patients in different places for more than 10 years. I've seen thousands of guys with prostate issues suffer in silence over the years. And trust me when I say that many of these discomforts could have been prevented with a single, easy modification in urination behavior. I'm here today to discuss a topic that most guys tend to overlook, despite its apparent simplicity: proper urination technique and its direct effects on prostate health. It may not seem like much to many of you gentlemen, but a bad habit can lead to a number of serious urological problems. This covers ailments like chronic prostatitis, benign prostatic hyperplasia, and that bothersome, desperate urge to get up many times during the night to use the restroom. I've heard a lot of my patients say, "Oh, Dr. Jane, I'm just getting old. So let me be clear, my buddy. Getting up a lot is typical. It's not natural, sir. Furthermore, things don't have to be that way. We must first discuss anatomy in a straightforward manner, without using technical medical jargon, in order to help you see why this error is so harmful and how it impacts your quality of life. Imagine your bladder as a water balloon, similar to the ones we used to play with as children. Urine is stored in this muscular organ. Your prostate, a little gland the size of a walnut that encircles the urethra, the tube via which urine leaves your body when you use the restroom, is located directly beneath that balloon. Urine flow is regulated by the prostate, which functions as a kind of valve. It's crucial to understand that the prostate naturally tends to enlarge with age, a phenomenon that affects all men. And that's precisely when the error you may be committing each time you urinate turns into your biggest adversary. Because when you make this error, a gland that is already susceptible due to aging is subjected to needless, continuous pressure. Gentlemen, prepare for the revelation I promised. This is highly important, so pay close attention. Pushing or straining your abdominal muscles to try to speed up the flow of urine is the most common and dangerous mistake that many men do when they urinate, and it can gravely damage your prostate. That's correct, indeed. You push yourself and exert force in the hopes of finishing sooner. I'm aware of what you are most likely thinking at this moment. However, Dr. Jane, there are moments when the flow is quite poor. It either stops or takes a very long time to start. How should I proceed? It is completely normal to feel pressured to finish more quickly, particularly when using a public restroom, when you're rushing or when you feel like you're almost done but have a bit more to do. I fully understand. Over the course of my 15 years in practice, hundreds of my patients have expressed this exact grievance. However, Allow me to describe just what happens within your body when you do this. When you exert a lot of force and strain, you are producing what is known in medicine as a tremendous counterpressure. You're straining the entire process in an unnatural way rather than allowing your bladder to contract naturally, relaxedly, and efficiently to expel the urine. Your prostate and bladder receive the direct effects of the high pressure you're producing. Every time you urinate, your prostate, which is probably already slightly enlarged or irritated from aging, is subjected to direct, continuous, mechanical stress. Imagine shoving or punching your prostate a few times a day, every day. Prostate edema might be considerably worsened by this ongoing recurrent stress. The fact that it can result in what is known as P reflux is far worse, much worse. What does that signify? Imagine the urine building up in your bladder as a result of the pressure you apply, pushing it back instead of flowing naturally forth. In the medical field, what I'm describing is referred to as post-void residual or incomplete urine retention. And now for the important part, buddy. This leftover urine that remains there and isn't removed creates an ideal environment for germs to grow, like to a petri dish. Your chance of getting recurring UTIs is significantly increased by this, and your prostate becomes even more inflamed as a result of those illnesses. Do you see how a very vicious loop is created by this? It resembles a wheel that never stops spinning. Infection, pressure, retention, inflammation, and more inflammation. If you don't break it now, it could lead to a cycle of pain and long-term harm that lasts for years. And listen carefully, since this poor practice has another very dangerous effect. Pushing continuously confuses your bladder and all of its muscles. The detrusor muscle is the primary muscle in your bladder. Urine is naturally expelled by squeezing this muscle. What do you think happens, though, if you press with your abdominal muscles all the time? As a result, the detrusor muscle becomes slack and less effective. This muscle gradually loses its inherent tone, strength, and capacity to contract completely without assistance. This is referred to as a hypoactive or lazy bladder in medicine. As a result, gents, your bladder never completely empties, which makes you feel the urge to urinate considerably more frequently, even if you just used the restroom 30 minutes earlier. Something is always left inside. Naturally, this disrupts your sleep and ruins your rest by requiring you to get up 3, 4, and 5 times during the night. Additionally, I've witnessed it in my patients, so don't tell me it doesn't affect you. Your energy levels drop, your concentration deteriorates, your mood becomes irritated, and your general health gradually deteriorates when you don't get enough sleep. My friend, this unhealthy behavior isn't simply hurting your prostate. Restorative sleep and the sense of total relief that comes from completely emptying your bladder are precious things that are being stolen. Before you say, "Oh no, Dr. Jane, am I doomed?" No solution exists. Allow me to share the wonderful news with you. There is a solution. It's easy, organic, totally free, and accessible to everyone. However, it does need for awareness, discipline, and regular practice. Here's something you should always keep in mind. Calm urination is the proper technique you should start using immediately. Urinating is a deeply relaxed act that requires no force or effort. Pay close attention to the steps I'm going to outline for you. Use the restroom as soon as you feel the need to urinate. Don't suppress it. Don't wait until you can no longer resist the impulse. Take your time once you're in the restroom. There's no hurry. You're not being pursued by anyone. Do the reverse of what you've always done, which is to push with your abdomen. Your pelvic floor and abdominal muscles should be completely relaxed. Imagine that gravity and your body's natural relaxation are doing all the work, letting the pee flow out on its own. Don't try to force things. Pay attention to your breathing. Take slow, deep breaths. Let your shoulders drop. Let your chest drop. Let your diaphragm relax. And simply allow the flow to begin and end spontaneously. And now, for the very crucial part that I want you to remember forever. Please fight the nearly overwhelming urge to push to get out what's left if the urine stream stops before you feel like you're finished. Simply remain silent for a few seconds when your bladder is entirely relaxed and not at all tense. Your detrusor muscle will have another opportunity to contract on its own and release the remaining pee without producing the dangerous pressure I've been describing. The secret to your long-term prostate health is patience and thoughtful waiting. Now, I'm going to give you 3 more ideas that are really essential, and that, in my many years of practice, I've seen work miracles in my patients to help you develop this important habit and genuinely safeguard your prostate. They have the power to alter your life, so pay close attention. Your peeing position comes first. I am aware that a lot of males prefer to urinate while standing up due to its speed, comfort, and practicality. However, you should be aware of this if you are already suffering symptoms of a prostate problem, such as insufficient flow, that bothersome dribbling at the end, or the need to urinate every hour. Sitting is the most effective and suggested position for obtaining complete calm urination and making sure your bladder empties completely, according to numerous scientific research. Sitting greatly aids in the relaxation of all pelvic floor muscles, resulting in effortless, natural urine flow. I'm aware that it may be culturally taboo for many guys to acknowledge that they urinate while seated. But trust me, your prostate will be quite appreciative. This has nothing to do with your masculinity or anything. It has to do with your well-being, health, and ability to have a good night's sleep. The second crucial piece of advice is to never haste. Spend as much time as you need in the restroom, whether it's 30 seconds, a minute, or even 2 more minutes. It's far better to wait and use the restroom later, when you can truly spend the necessary time to do it relaxedly if you're in a rush right now. My friend, hurrying is your worst enemy. You must be patient with your prostate. Third, here's a sophisticated method that is incredibly powerful, but that not many people are aware of. Double voiding. What is involved? Lean slightly forward while still sitting or standing, and wait another 5 to 10 seconds after you've finished urinating in a calm manner without hurrying or pushing. This straightforward lean frequently makes it possible to expel any remaining urine that didn't come out the first time, ensuring that your bladder is considerably more full, emptying, and drastically lowering the frequency of bathroom breaks. Now, since I am aware that this is a prevalent topic, I would want to respond to one that a number of you have posed to me in comments on earlier films. Some people ask, Dr. Jane, but I feel like it doesn't come out completely if I don't strain, and then some of it escapes into my underpants. How should I proceed? Is there a gadget or prosthesis I may use to correct this? Good question, gentlemen. Let me clarify. First, as I previously mentioned, the reason for your post-pee dribbling is the residual urine retention. Pushing harder is not the answer. The reverse is true. Use the double voiding method that I just showed you. Hold on for a few more seconds. Bend forward. Allow the urine that is stuck in your urethra to be naturally expelled. Yes, there are medical solutions for severe cases of benign prostatic hyperplasia in terms of implants or prostheses. The urethra can be kept open by urethral stents, which resemble tiny tubes. Additionally, a relatively recent surgery known as Urolift uses tiny implants to lift the prostate tissue that is blocking the flow. However, it's crucial that you realize that these operations are only used in extremely serious situations where the obstruction is extremely severe. I advise you to attempt this natural, calm peeing method for at least 30 full days, every day, regularly, before you reach the point where you need surgery or devices. Allow your body to recuperate and retrain its urination system. I've witnessed amazing stories of patients who saw significant improvements simply by breaking this behavior. Don't give up before making an effort. Since we're talking about this, allow me to address another frequently asked question. Do women also experience the issue of waking up several times during the night? Yes, Nocturia, the medical name for regularly waking up in the middle of the night to urinate, can also affect women. However, for clear anatomical reasons, the causes are different in them. They lack a prostate. In women, it may be brought on by infections, diabetes, weak pelvic floors, or just consuming too much fluids right before bed. However, that would be the subject of an entirely different video made specifically for ladies. Now, there are other aspects of your everyday life that have a significant impact on the health of your bladder and prostate in addition to your bathroom habits. Gentlemen, staying hydrated is vitally essential. Water consumption should be spaced out evenly throughout the day, from the morning to the afternoon. However, stay away from drinking a lot of water shortly before bed. My patients are advised to consume their final glass of water no later than 2 hours before to bedtime. Additionally, and this is very important, you must significantly reduce your intake of alcohol and caffeine, particularly in the afternoon and evening. Why? Since both are strong diuretics, they can irritate your prostate and bladder and cause you to create more urine than usual. If you have prostate problems, coffee, tea, beers, alcoholic beverages, and caffeinated sodas may be detrimental to your health. If you don't want to, I'm not advocating for their total elimination, but do drastically cut them down. Regarding the home cures that some of you have mentioned in the comments, I saw that one of our friends mentioned that he drank a particular kind of lemon drink and that it improved his quality of sleep that night. As a doctor, I must admit that drink contains a lot of sugar and caffeine, even if I appreciate everyone's own experiences. Furthermore, even though lemon contains anti-inflammatory qualities, I cannot medically suggest that combination as a treatment. If it did work for them once, it could have been a coincidence or something else. I suggest evidence-based, scientifically validated remedies. To make everything extremely apparent for you, my buddy, let me go over everything we've discussed today in detail. Pushing or straining your abdomen when urinating is a major mistake that damages your prostate every day. This extremely prevalent behavior raises the risk of infection, worsens prostate inflammation, causes residual urine retention, creates detrimental counterpressure, and starts a vicious cycle that is difficult to break. You can start using relaxed urination as a remedy right now. Inhale deeply, relax your abdomen entirely, and allow the flow to occur organically without any pressure. Add to this by urinating, sitting down if you already have symptoms, never hurrying, practicing double voiding, drinking plenty of water throughout the day but less at night, and consuming less alcohol and caffeine. In addition to protecting and caring for your prostate, these easy yet effective lifestyle adjustments can also significantly enhance your quality of sleep, lessen or completely eradicate those bothersome UTIs, and provide you the relaxation and tranquility you so richly deserve. I swear you'll feel like a different man. Please like this video and share it with a friend, relative, coworker, or neighbor you know is experiencing this if you felt that the material was useful and you learned anything today. I want to give you a personal challenge, since so many guys suffer in silence due to ignorance or shame. You can help them by sharing this life-changing information. After 14 days to 4 weeks of using the calm urinating technique, return here and share your experience in the comments section. Have you noticed any improvements? Get more restful sleep? Cut back on the amount of journeys made at night? Write your progress in the space provided here. Because other men who are unsure if this truly works are inspired by these genuine testimonies. Remember to subscribe to my channel for more useful, trustworthy information on prostate problems, men's health, and other subjects that are vital to our quality of life, but that we are sometimes ashamed to ask about. I'll provide the 5 foods that specifically lower prostate inflammation in just 21 days in my next video. You most likely already have these items in your kitchen, but you were unaware of their therapeutic potential. Don't pass it up. I have one final question for you before I leave. Do you typically urinate while standing or sitting? I'll post a poll on the channel's community page for you to vote in, and I'll show you the results in 3 days. What we discover will surprise you. Remember that you are in charge of your own health, so take good care of yourself, dear buddy. Please share this video with a loved one, hit the like button, or leave a comment if this film has touched your heart in any way. Remember to subscribe and press the bell button if you want to follow along with me as we explore health, healing, and living life to the fullest in your golden years. I'll be right here with you every week, reminding us all that we're still here. I'll see you in the upcoming video.